Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hello, everyone, and welcome back. Today, we're continuing our conversation with Dr. Kara Margolis. In the last episode, we learned about what the gut-brain axis is, the importance of it, and also touched upon a few of the different factors that influence our gut and mental state. Today, we're going to focus on the science behind this, and who better to learn this from than Dr. Margolis?
Thank you for having me.
Yes. So usually when we make a decision, we try to follow our gut feeling. That's why we call our gut our second brain. So can you explain why our gut is our second brain from a scientific point of view?
Sure. I think that what really has been one of the most amazing discoveries over the last 50 to 100 years is the presence of this nervous system in your gut. So we call it the second brain. The more scientific term for it is the enteric nervous system. And so this is a very complex nervous system. Has about 500 million neurons. So that's actually more neurons than the spinal cord. And it has many different types. Virtually every type of nerve cell that you find in the brain is also in that gut nervous system. And it plays critical roles in how the gut moves. So we call it gut motility, but things that govern constipation or diarrhea. It can govern inflammation. So inflammation can be everything from like inflammatory bowel diseases to even things like nausea. And what's I think most impressive is that the enteric nervous system can cause the gut to function completely independently from the brain. So even though there is this continuous bidirectional communication between the gut and the brain, and they really do, I think, need each other to work optimally, that if you were to actually take a gut out of a person's body and just keep it in an organ bath of like where it would be normally in the environment in the body, it would actually move and could push food and poop right through it without input from any other part of the body. So it really is a second brain.
Wow, like our gut is really smart then, and it's really cool how we have almost every single nerve cell and neuron in our stomach. I thought neurons just belong in our brain, but I think it's really cool how they're also in our gut. And then you brought up the example, like even if your gut did not communicate with your brain, it can still function completely fine and healthy. And I think that just really shows how smart our body actually is.
I think our gut is brilliant.
Yeah. And if our gut is called our second brain, and then if we have a neurodevelopmental challenge like ADHD, dyslexia, or autism, does that indicate something in our gut too? And what relationship do these have?
Sure. As I said, virtually every type of nerve cell that's present in the brain is also present in the gut. And so, what research has revealed, in part from the research we've done in my laboratory, but also multiple other scientists have shown that when there's a nerve cell that, say, develops in a different kind of way that may be implicated in a neurodevelopmental disorder, those same nerve cells are generally also altered in the gut. So, what you see a lot in patients in autistic kids or autistic adults is that they have very high rates of gastrointestinal disorders. So, when you have a different kind of development in the brain, say in a serotonergic neuron, that those same serotonin neurons in the gut are likely also to be impacted. And in the brain, that manifests as the signs of an autism related disorder, but in the gut, that manifests as, say, constipation. And there's a variety of digestive disorders that patients with neurodevelopmental disorders have, but constipation by far is the most common. And it really happens because when you have a different kind of development of the nerves, it's really hard for them to communicate effectively with one another, and so they don't move as well, and things like constipation can develop.
Wow. Yeah, and now I'm trying to think, since your research also lies into this, how do you focus on like fixing or not fixing, but bettering the situation that is there? So one like thing that I'm thinking of is usually there's types of medicines or pills or something you can take to improve your gut microbiome. So is there something like that you can do with the neurons in your stomach that you can eat to actually improve like the symptoms of autism or something?
Sure. So I think one is that when you talk about the microbiome, it's been so hard to find things that can alter the microbiome in ways that can make a difference uniformly across people. And that's because the gut microbiome is so different between people. It's as individualized as someone's fingerprint. I think that when you talk about the neurons and how to do it to make things better, I think what science has shown us repeatedly is the thing I think that my parents and my grandparents drilled into me, which is eat healthy, avoid processed foods, avoid the packaged foods. Those are the things that have been shown to give the gut the most kind of energy, to really enhance those pathways that go from the gut to the brain to make people feel better, to make people feel like they have less brain fog. And if your stomach also feels better from eating those foods, your brain is likely to feel better as well.
Yeah, and that reminds me of the saying where they say instead of using medicine as your food, you use food as your medicine. And yeah, I think you really highlighted and put that really well that you don't have to use like medicines and pills to fix it. You can just, if you eat healthy food, then make that part of your lifestyle and that makes a much better difference. And I think we've all felt that, like the days we eat more healthy and like natural foods versus processed and junk kind of foods, then we all feel and experience the difference in our mood that day.
I think it's a great point. What I want to say there too, though, is look, people oftentimes for medical conditions need medicine, and nutrition certainly is not the only answer in a number of things. But what I would say is that eating a good diet does nothing but help. And I'd say there's also maybe other things in the diet that may be helpful to avoid besides ultra processed foods, like something like when you were talking about when you're thinking about eating a processed food diet that you don't feel as well, things that cause high sugar spikes. So I know that if I'm going to eat a huge chocolate bar at 10 o'clock in the morning, that by the time I'm meeting you in the afternoon, I'm feeling edgy and tired because my sugar level has crashed. And it's similar with caffeine, that caffeine gives you this high. And certainly I've had my normal coffee in the morning, but I find that when I can really limit those kinds of things, the high sugar foods, limit caffeine, that those things also help regulate your system and can make you feel more energetic and better throughout the day.
Yeah, I think you put that very well. And moving on, I had another question. Have you ever had a case where an unhealthy gut state and mental health state got in a loop and just kept on getting worse?
Sure. I think that actually happens all the time. It's what I say, by the time I see a lot of kids, it's been years of anxiety and abdominal pain. And, what happens is when your stomach feels bad, kids get anxious, or adults even, about can I go to work that day? Can I focus on what I need to do? If I eat a certain food, am I going to feel worse? And it gets to the point where some people don't want to leave their houses because they're so worried about these things. And at the same time, anxiety in itself causes a whole bunch of other concerns and things that really people worry about. And these things often go in a loop and a spiral because of this communication. And it's why when we've talked about patients coming in with both conditions, it's really important to focus on both together for exactly that reason, that if you treat one, but you're not treating the other, it can lead to this loop that's really hard to stop.
Wow, so how do you break the cycle? Is it easier to uplift our energy or our gut state?
I would say that the best approach is to try to treat both. A lot of times I will say to a patient, what's your worst concern here? What's your biggest concern? Or where is the worst pain? Is it in your head from anxiety or is it from your gut? And a lot of times people can pinpoint that. And if that's the case, sometimes you can focus more on one system than another. But a lot of times it's like you've just said, alluded to when you said, how do you get out of this loop? That it's so confusing and there's already this loop going, that really the best approach is to try to treat both at the same time. And that can be either through, say, directly treating the gut through diet and the brain through medications. Like we said, a lot of the medications that work in the brain also work in the gut. It can be a variety of different approaches, but I think really trying to tackle both at the same time tends to be the best approach, at least for me.
Yeah, and it's wonderful to use a holistic approach. And I feel like you said, if you just focus on treating one, like the gut or the brain, you fixed one, but the other's still going on. So it's going to restart the loop again.
I think it's really important that when families come in, a lot of what I talk about is just how connected that gut and brain communication is, because people don't understand that when you're focusing on abdominal pain, that sometimes anxiety is so intimately involved in that, that you have to treat both to go in there. They're not isolated systems. And when we treat them separately, it's much harder to treat the person as a whole.
Got it. Yeah. And now shifting a little from having consistent anxiety to anxiety when it's like situation based. We've all been in many like high pressure and stressful and anxious situations, like the night before an AP test or the last point in a game, from the week of finals to the night before a big day. So, what can we do to reduce the stress and anxiety we feel, especially when it's really close to that high pressure activity?
So I do this all the time. Still, when I give big talks, I get nervous. I think a couple of things. I think exercising is great. It releases chemicals in your brain that normally calm you down. Getting good sleep. Sometimes when I'm anxious, I'll sometimes just do jumping jacks in my office just to get my blood flowing and to get those endorphins going. Like we said, taking a walk outside. These are things that naturally calm the body and can help you regain control. And I would also say, just from an academic perspective, that when you're giving a big presentation, always be as prepared as possible, because the more prepared you feel, the less anxious you're going to feel in general. There are medicines that sometimes adults take for that sort of acute anxiety that happens. I think a lot of these other ways that you can do it just through natural habits may be really helpful too.
Got it. Yeah, and I think exercise is a big one. Like I notice too, when I'm feeling a little like stressed or something, I like to go outside and go play a sport or do my sport, because I think your mind goes off of that topic, so you're not constantly thinking about it. But then when your body starts moving, you can pay attention to something else, and that kind of helps you relieve stress.
I think the thing that I missed out on and I didn't say, which is important too, is social connection. Connection with people, connection with your family or your friends, your pet. Things that make you feel seen and valued are also naturally calming. So those are other things you can do. Go out with a friend for a walk or for lunch and have a talk with your mom or dad if that makes you feel better. Things like that can also be really helpful.
Yes, social connection is definitely a really big one. And yeah, having connections just makes you feel like you are valued and you bring something into the relationship, which also ultimately increases your own self-esteem. So, Dr. Margolis, thank you so much again for sharing these pearls of wisdom with us today. Before my big performance or presentation, I will definitely be doing some jumping jacks. And I had an incredible time with you today, and I can't wait for our next episode together.
Great. Thank you.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every month, so make sure to continue to check those out. We hope you enjoyed this podcast, and we thank you so much for listening.